Countdown, 3, 2, 1.
Good morning, everybody, and welcome to the Human Services Committee meeting for Tuesday, September 21st. First item of business is the approval of the minutes for the Human Services Committee meeting of September 7th. Is there a motion to approve?
I will so move, Mr. Chair.
Commissioner Nissen moves. Is there a second?
I'll second that.
Commissioner Anderson seconds. Thank you very much. Any discussion, corrections, additions, deletions? Hearing none, all those in favor of approving the minutes signify by saying aye.
Aye.
All opposed? Motion carries. Thank you. Second item of business is the allowance of bills for the as provided to us previously for September 21st. Is there a motion to pay the bills?
I'll make that motion. Sorry.
Commissioner Anderson, thank you. Is there a second?
I'll second it.
Commissioner Berg seconds. Thank you. Discussion? Hearing none, all those in favor of paying the bills signify by saying aye.
Aye.
All opposed? Motion carries. Thank you. Cancellation of the warrants that was provided to us in our packet. Is there a motion to approve cancellation of the warrants?
I'll move cancellation of the warrants.
And I will second that.
And Commissioner Nissen, thank you very much. Any questions, discussion? All those in favor of canceling those warrants signify by saying aye.
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 All opposed? Motion carries. Thank you. We have no agreements, contracts, anything of that nature. At this time, we have a Community and Environmental Health Annual Report, and we're going to hear from Denise Kragenbring. And Denise, you have some folks that you'll be introducing as we go?
Sure.
All right. Thank you very much. The floor is yours.
Good morning.
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 So I decided this morning I'm going to start with a little humor. It's my staff that are here know that generally on our staff meetings, we usually start with a joke, which is usually me, and I don't write them. I just give them. But we all know that, laughter literally does make us feel better, makes us stronger. Studies found a good laugh boosts our dopamine and can even shore up our immune system. So I'm going to start with a joke. Now, I know there's husbands and wives listening and in the room, men and women. So just know you could substitute in my joke the husband for the wife for the husband, okay? Just want to make sure I'm not targeting out husbands here, right? Okay, so a husband and a wife were in the middle of a big argument, giving each other the silent treatment. We've all been there, right? You just decided, shut down, I'm not talking. The husband suddenly realized that he needs to have his wife wake him up at 5 the next morning for an early business flight, right? He doesn't want to be the first one to break the silence and admit defeat, right? So he writes a note on a piece of paper that says, please wake me at 5 a.m. Puts the note where he knows she's going to find it, right? So next morning he wakes up, it's 8 o'clock. He missed his flight. He's furious. He's starting to ask his wife, why didn't you wake me up? And he looks and he sees a note next to him on the bed that says, it's 5 a.m., wake up. I gotta laugh. All right, so again, good morning, and thanks for letting me come here and have an opportunity to share some of the stories of what's been happening in the disease prevention and control world and some of the other programs and areas that I supervise. You all know that we had challenging times in 2020, and that's the majority of what I'm talking about today is what things look like in 2020. Some of the staff are here today, and I will introduce them as we go. I might even do it here at the beginning too, but just want to shout out to say that we had some fabulous staff in public health, and not just in the areas that I supervise. You all know Jody, first of all, Jody Ammerman, the other supervisor for public health. She would absolutely agree that the staff were really challenged in 2020 and came through it with very positive attitudes. A huge amount of flexibility. All of the work changed. A lot of work had to continue, and a lot of work had to change, and we had to do different things. And so I just want to start out by saying how proud I am to work alongside the folks that are up here and all of our staff, our dedicated employees in public health. We came through the year with new ideas, new ways of doing things, new opportunities, some things that will absolutely carry forward in our work for years to come. So it wasn't all bad. We learned some good things, and we we showed that teamwork can really happen and really positive things can come out of it. Sorry, I gotta get this back up again. So we'll get started. Let me do this. I will probably talk about some of the staff as I go through their areas, but let me just introduce in the beginning as well. So first off here we have Ashley Klein. She is a public health nurse. The nurses are all part of our disease prevention and control team. So a lot of the activities are throughout the team, but primarily Ashley is responsible for our child and teen checkups program and for our correctional health work, our contracted work that we do with Prairie Lakes Youth Program. Then on the far side in the back is Rita Laughlin. She is primarily our intake nurse, which the best way to describe that is just everything, anything that comes through. So basically the first line of a nurse to speak with the public and or staff comes through intake. All the referrals, everything comes through intake. So it's, besides all of the disease prevention and control activities, it's a plethora of other things that Rita takes care of for us. The next one is Alicia Ranki. Alicia is part of our support team, our staff support. You all know that things don't run without folks like Alicia. She takes care of all the details and all the things that support all the programs and all the work that we do in public health. So that's a huge job, and Alicia is great at it. Next to her is Carmen Mclennan. Carmen was in human services before as a public health nurse. Now she's just come over to public health, so we're teaching her all kinds of things now, and she'll have lots of new roles, and some of it I'll talk about as we move in, but we're very, very happy to have Carmen with us in public health. So before I get into all of them, you'll remember I already did talk to you about our Emergency Preparedness 2020 work. That particular piece I already presented up here, so I'm not going to go through that one again. I know that along these meetings, Jenny keeps you up to date at some of the activities that we're doing, following through in 2021 related to emergency preparedness and what we do surrounding the coronavirus pandemic response. But just as a reminder, just in 2020, from my emergency preparedness report, our staff dedicated 7,921 hours in response to that pandemic just in 2020. So I'm going to start out with the first story that I'm going to talk about basically is our disease prevention and control story, all of the work that we do surrounding diseases, which of course coronavirus and that pandemic was a big piece of that. But there's certainly other activities that went on in 2020 with our staff around infectious disease. You can see on here just a brief explanation about what our role is around disease prevention. As I stated earlier, many of our activities were interrupted or affected in some way or another due to the pandemic. Many of the staff were redirected to other duties. The majority of our disease prevention and control staff, the nurses, were put into leadership roles in our ICS, incident command structure. And so they had to do some very different things. But some of the things that did go on the left side, you're going to see our immunizations statistics. So just as a reminder for some of you that might be newer with the board, we do have immunization clinics in our office, generally 2 times a month. In August, we have an additional one as kids are getting ready to go back to school. But in general, they're 2 times a month. In the past, it was a walk-in clinic. So in 2020, things kind of changed with the pandemic and what that would look like. So for a while, between April and July, we didn't have any in-person immunization clinics. In August, we started having our clinics again. And we looked at it a little differently. How do we make this work now with some of the safety measures that we have in place for the COVID pandemic? So we had people call and make an appointment for one thing. That was the first change. We had never done it by appointment before. We were always walk-in. So we changed it, had it by appointment. The other thing that we changed is when people called in, we got all of their information at that point. So generally in our walk-in clinics in the past, when they come in, we look up immunizations in the registry. We call it MIC, Minnesota Immunization Information Connection, MIC for short. That's where everybody's records are held. So we would look up and see what you've had before, what you need, or we would add them in if they've never been in Minnesota or never had a record in that system. So in the changes in early stages and into August of the pandemic, we did all of that over the phone ahead of time. So we knew when that person showed up, we knew exactly what they needed that day. So what that does, it really takes down the in-person time, because they come in and it doesn't take nearly as long to have those conversations. Obviously, there's still things you need to do in person in terms of explaining and screening and educating and all of those pieces. But it really did decrease the amount of time that it took when people came in for their immunization. So that's something that we're continuing now in 2021, and probably will even when there are no pandemic restrictions or thoughts. It works really well. People have a given time to come. We can get a lot of things done ahead of time and be much more prepared, and the waiting time and the face-to-face time is reduced significantly. We also use the no wait inside system that I'm sure you've heard about on other people that have spoken over the past year. We used that when we were much more restricted on coming into the building. So you can see our numbers went down, and that's for good reason. Like I said, we didn't even have clinics between April and July, and the number of folks that are coming to the clinic was significantly down in 2020. We were trending downward even prior to 2020, as you can see in the graph there on the left. So in terms of childhood rates, that graph is on the right side of this report. That decreased a little bit as well, and that trend happened across the state, across the region, and likely for a number of reasons. I mean, as you know, in other areas, folks weren't going in to see their doctor for a lot of preventive care, and that included immunizations. So everybody's working hard to get those rates back up where we want them to be, but it's not a huge surprise that that's what that looked like. We'll see what 2021 looks like and see if we can't bring that curve the other direction.
Denise, just a quick question, if I may. It looks like even before the pandemic, going back more than several years, that 80% goal line is never hit. Is this something of a surprise to you? I guess it is to me, because I just assumed, of course, most of us are old enough up here to remember that you just got your shots and there wasn't any question about it.
Right. No, I would agree. It is a little bit surprising. I mean, that goal was set a long time ago, probably thinking that that's not going to be as hard of a goal to meet, but we're seeing everywhere across the state that it is a difficult goal to meet. And I don't know if that's going to change. I mean, we all know that there's been, a significant hesitancy with the COVID vaccine, and is that going to cross over to all vaccine, all immunizations? We just don't know. So we keep shooting for it and keep educating, the community and the people that we see, in hopes that we can certainly reach that.
Okay.
Mr. Chair.
Commissioner Berg.
Yeah, kind of a follow-up question on that then. The statistics, then you're 80% and stuff, is that for the whole county, and that include Cares Health and so forth doing
It
vaccination?
does, yes. This is the entire county. Yeah.
All for the county?
Because we at Public Health are a very small piece of that. I mean,
Sure.
we are more, I would say, the net to catch folks, because all the children that are insured really should be getting those vaccinations at their provider. Because there's other pieces that go with that obviously we can't offer. Those visits that you should see your doctor, all that we can offer is the vaccination. So we're really catching those folks that are not insured, or a lot of those folks that are insured on, Minnesota Care, MA, UCare, Blue Plus, those folks. So the majority are seeking those to their provider. So yes, these statistics here are not, the blue box is who's actually coming to see us. But the immunization rates, and that's for completion of the full series, so what is recommended by the age of 2. So the majority of that would likely be done at a provider.
Okay, thank you.
Yeah. Good questions. So the other thing that I put on the front of that is the top 10 diseases in our county, and that's strictly by number. That's not a rate, it's by the number of those things that are showing up strictly in our county. That did not change from last year. Those same top 10 are the top 10 this year. There hasn't been a lot of change in that other than the TB came in as number 10. I think that might have been 2 years ago that hit one of the number 10. I'm guessing moving forward that might fall off again. Our numbers have come down in the last few years with active TB cases, but those are just of interest, the diseases that we're seeing in our county. So if you move to the back side of that report, I don't know how that looks. If you're looking at the same screen as I am, this actually is the flip side of the piece of paper, but talks a little bit more about our activities and just gives you an example. And I know I went over this coronavirus corner and all the information and all the things that we did around COVID. I did that with emergency preparedness, so I'm not going to get too deep into that. But I do want to talk about some of the other data, talk a little bit about TB and latent TB. So you can see on that active TB graph that we did not have any active TB cases in 2020, which has been a while for us that we've gone through an entire year without any active cases. You can see back in 2017, that was the year, those of you that were on the board then, the reporting, we had a couple of really big contact investigations during that year. We had active cases that involved some exposures at school, so those were really busy times for us. But in 2020, we did not have any active cases. So I want to just spend a couple minutes just explaining the active and latent, because we always talk about active TB and we talk about latent TB, and some of you maybe have not heard me talk about that before. But an active TB case is a person who has active, I keep using the same word, but actually has tuberculosis. It could be infectious, where they could spread it to somebody else, or it might not be, and it depends on where those bugs are. If they are in the lungs, they can actively spread that. TB can be anywhere in your body, so there could be a case of TB and they cannot spread it to anybody that they're around. But if it's in their lungs, they can. So that's when we say active TB, those are the people that we're talking about. So when we get referrals such as that, we have to do what we call a contact investigation if it's in their lungs where they have the capability of spreading it. Then we're looking at, where have you been, who have you been with? And again, it's some significant time that you've spent with somebody. So that's where that whole contact investigation comes into play, to look at where have you been, who have you been with, and then starting with a smaller ring of people, identifying who those are, hopefully being able to contact them and do some TB assessment, do a TB test and see, do you test positive for this or not? And if there aren't a lot, then we can stop there. If there are some positives, then you move to another ring, and that's how contact investigations go. So the word latent TB comes in when somebody has the bugs in their body somewhere, but it's not causing an active infection. So you could be exposed. Not everybody's going to get TB if they're exposed to it, but those bugs might just be hanging out in your body. When we explain it to people, we say they're asleep. It's just an easy way for people to understand that the bugs are there, but they're not causing any harm. They could wake up. Most statistics that you'll read will say about 1 in 10 persons that have latent TB, if they're left with no treatment, will likely become active at some point, get active TB at some point. So the latent TB folks are the ones that we want to get. I mean, obviously we treat the active TB too, but the latent TB folks, we also want to get into a treatment regime. There's 2 different drugs you can treat latent TB with. Rifampin takes 4 months of treatment. INH takes 9 months of treatment. So when you're looking back at our latent TB cases, back over the years, like say, look back there at 2015, we had 182 cases. So those 182 folks were coming into our office once a month to get their medication for their latent TB for 9 months, because most of those folks then were being treated with INH. So, and that's so that we can prevent those folks from getting active TB. So you can see that has dropped off significantly as well over the years. In 2020, we had only 4 latent TB cases, and again, 0 active TB cases. Right now in 2021, we have one latent TB case. So again, we're doing pretty well on the TB and latent TB arena, so to speak. So I just wanted to clarify when you hear active versus latent to help you understand what that means. Then the other graph down there looks at refugee and immigrant health. Our work with refugees and immigrants, with both of those groups of people is pretty similar. Oftentimes they're new to the country and or very new to our area. So it's a lot of support. It's a lot of letting them know what the resources are in our county. You know that we're full of resources in Kennewick County. We have a lot of things to offer people. So we're helping with that. We're helping connect them with the pieces of what needs to happen in terms of getting an exam, whether it's an immigrant exam or a refugee exam. And most of all, we're helping them get the proper immunizations. There's specific regulations on what is required for refugees and immigrants in terms of immunizations. So we help with that, and we help connect them with getting assessed for tuberculosis. Oftentimes that is a blood draw now versus the typical Manto test that we used to do for a lot of people. So sometimes it's connecting them with the right people to get those things done. So you can see our numbers have gone down over the years in refugees and immigrants. In 2020, you can see we had 9 refugees and 10 immigrants. The 9 refugees were all primary refugees. So that's another term I just want to clarify. First of all, the difference between a refugee and an immigrant, and what does a primary versus a secondary refugee? Because I think at the back of your reports, you actually get the tables of data. It'll specify primary versus secondary and where folks are coming from. But both a primary and a secondary refugee are obviously not citizens of the United States. How did I write that down? Okay, yeah. They're both foreign-born, obviously, and not citizens of the United States. And refugees are coming to us, to the United States, because they can't return to their country because of a well-founded fear of persecution. And that can be due to race, religion, nationality, political opinion, or membership in a particular social group. So that's the specific words of what defines a refugee. The status of a refugee is generally given to somebody before they enter the United States, and that's done by the State Department or the USCIS, the United States Citizenship and Immigration Services. So a primary refugee is somebody who initially settles in Minnesota. Doesn't necessarily have to be Kennewick County, but their first place from wherever they came was Minnesota. I'm going to Minnesota. That's a primary refugee. A secondary refugee is somebody who, say, came from wherever they came from and they settled in, let's say, Ohio, and now they moved to Minnesota. That's a secondary refugee. So in the past, I mean, when you look back at our data, we saw a lot of secondary refugees, not quite as many primary as we did secondary. People moved around a lot and then resettled in Minnesota. Now, as you can see, our numbers are down both in primary and secondary. We had no secondary refugees in 2020. And then in terms of immigrants, they are also foreign-born and not citizens. They either come with an immigration visa that was issued abroad, or they are adjusting their status in the United States from temporary to a permanent resident. So that's some of what we're helping with them, the steps for them to do that, which includes some specific lab work, a specific immigration exam, and again, specific immunizations and TB screening as well. Some of the other work that we would do either with immigrants and or refugees, if they're coming with families, we're going to help them figure out school registration, and some of those things may help with some housing resources, that sort of stuff. So that is the majority of the immunization, that piece of it. Do you have any questions before I move on to the next group or story?
It appears not. Go ahead.
Okay. The next area that I want to talk about is our environmental health. We don't I don't have Chris here today, so we have 2 environmental health specialists. Our environmental health program is completely together with Renville County. It's as a CHB, so the data that you see is for both. It's for the program as a whole. So we have 2 environmental health specialists. We have Chris Wenish here in Candioi County, and we have Dave Disted for Renville County. Dave also comes and helps with inspections in Candioi County because you can imagine Candioi County has a larger number of establishments than Renville County does. So therefore, it requires more inspections. But you can see on the top a little bit of our role of what the environmental health fellows, guys, do. We take a great pride in how we deal with our establishments. So they license and inspect. You can see food, beverage, pools, lodging. So that would include, mobile homes, recreational camping, all of those kinds of things. So we try, I'm giving them all the credit. I don't do any piece of this. But they really try to stick with education, try to just really work together, not as in a negative tone of saying, gosh, you didn't do that, but more how you can make sure that you're following the rules, you're keeping everything safe, particularly around food for the citizens of our counties. And they do a wonderful job at that. In the data, you can see the licensed establishments, how that's gone over the years. We did 307, is it? Yeah, we had 307 establishments that we licensed in 2020. That comes to, it's about a 70-30 breakdown when you look at the number in Candioi County versus the number in Renville County. And I don't typically split that out on the report because this is a report for the whole program. A little bit down in the inspection numbers last year, 332, but this is one place where the work had to continue regardless of the pandemic. There were some closures of some areas and some restaurants, depending upon if you had drive-through, the kinds of things that you did, but for the most part, their work had to continue. So they had to balance the normal work that they do with adding some of the work that came with the pandemic, which, as you can well imagine, came a lot of support. They had to do a lot of support, answer a lot of questions, particularly around the food establishments over the years. So a lot of education, a lot of responding to the public as well in regards of complaints related to some of the food establishments and non-compliance issues. So it was very hectic for them. And at least in our county, we also, Chris, who is our sanitarian, we also had him in our incident command structure. He was our logistics chief, and so he spent a lot of time at our clinics as well. So it's a real balancing act for them. We have in the past looked at average number of violations per inspection. Things are changing in the way, the food code changed for them in 2019, was it? And so things are changing in terms of how the violations and how those things are reported to the state. So our statistics are probably going to look a little different moving forward. But again, we want to really stay more on the positive and not on, check, you did this wrong. And they're both really good about doing that. One of the other things that we license as well are special events. Those are the things that oftentimes, what's a good example is the Robbins Island event, where there's lots of little establishments or little places that are offering food. So those are special events. We have to license, or we do license all of those. So Chris and Dave need to make sure that things are being done properly to make sure that the food is safe. And last year, in terms of special events, we did 111, which is significantly lower, obviously because of the parameters around the pandemic. In 2019, we did 422, so you can see that there was a big difference. We'll see what 2021 brings. I think that's probably going to be closer to normal this year on the special event arena. One other thing I'll just mention that's new now in 2021, so now I'm veering a little bit out of 2020, but in 2021, there was a change across the state in licensing of assisted living facilities. So what happened is that licensing, which was under us, the food part of that was under us as because we have a delegated agreement with MDH, but that's being pulled back now. It started in August. So that is it is a significant change for us in terms of revenue. Obviously, revenue in our environmental health program is related to license fees, and now there are a total of 19 establishments in Kandiyohi County and 6 in Renville County, so 25 total less, that will have fewer establishments for 2022, because we no longer will be licensing those folks. So just so you're aware that change has happened, it likely is going to be reflected in some fees for licensing moving forward. And there's just nothing that we can do about that. Any questions about environmental health? I wishing that Chris would be here so we could recognize his work for that. But okay.
Just one brief question.
Sure.
Regarding the complaints. There's a note in here that says many complaints related to executive orders. What can you give us an idea of what
I
that
will.
is about?
The majority of those complaints were around masks. That folks would and that was on both sides, that patrons were not wearing masks and or staff were not wearing masks.
Mm-hmm.
That was the majority of the issues. And as you can well imagine, that was a fine line as what do we have to respond to that other than, re-education. Obviously, we can go out to an establishment, or Chris or Dave can, and remind them of what is necessary.
Mm-hmm. Because it would have to have been pretty egregious to come to even any sort of an enforcement action or
Right.
that type of thing, and nobody really wanted to go down that road.
Right, that's what made it difficult. How much can you do? We weren't, as a county, we weren't ready to say we're shutting you down
Right.
because of this, that, or the other thing. So it was more about, we're going to support, we're going to educate, and do the best that we can to make sure that everybody and everybody's food is safely prepared and safely served. Yeah,
Okay, thanks.
good question. All right, the next story that I want to talk about or share with you is around our correctional health work.
I'm sorry, Denise.
Just a
I'm
quick
sorry,
question,
I didn't
Going
see
back to
Commissioner
inspections,
Yes.
yeah, you must get into a lot of different situations. I'm assuming then when you're doing special events, it'd be like the county fair,
Yep.
all the food places there. The food trucks, I'm assuming they go through
Yep.
the same inspection as a restaurant or whatever. You're geared up for what they're serving. Am I correct?
Yep, so I can back that up a little bit. So for a special event, there's an application that they have to fill out, and then part of that application, other than just the demographics and who you are and what you're doing, they have to list what they're serving, how they're preparing it, where it's being prepared, and all of that is reviewed by Chris and or Dave before we say, yep, you're good to go. We're going to allow you to have this special event. And the inspection is not required on every one of those, but our guys are both pretty good about going out there and checking each one out, because then we're looking at hand washing. What does that look like? Make sure that they have to have some sort of a hand washing station, whatever that might look like. It's a requirement. So is that kind of what you're asking? So, yeah.
Okay, thank you.
Yeah. It isn't as involved as, as inspecting an entire establishment, but it certainly still involves a fair amount of their time. Yeah. So the next one I want to talk about is our correctional health work, and we do have, again, Ashley is here this morning. She is primarily our nurse that goes over to Prairie Lakes for our contracted work there. Rita has done a lot of our work with the group homes over the years. We're going to be transitioning that over to Carmen. She is not doing that yet because she's brand new with us, but Rita's been doing it for many, many years. So we have had some contracted nurse work in both the group homes and at Prairie Lakes in both the secure and the non-secure area. So the little picture in the middle kind of shows you the types of things that happen over there. Our nurse visits, so that means Ashley, the times that Ashley visits with one of the adolescents that's over there, and they request that. They fill out a sheet that says whatever concern or issue that they have that they might want to talk to a nurse about, and then Ashley would be the person that they would see. And then Ashley would determine, is this elevate to where we need that person to see a provider or not, or is it something that the nurse can handle? So our nurse visits were down a little bit last year. Again, you can well imagine this is all related to the pandemic. There was a period of time where we weren't. We had no nurse on site from November 16th through the end of December, so about a month and a half at least where we weren't even on site to do such a thing. And again, it all depends on the number of adolescents that they have there at any given time and how many things that they want to see a nurse about, so that there's a real ebb and flow to that. We did include on there some of the common reasons that they want to see the nurse and or the provider. The reasons are pretty much the same for both. The number one reason is trouble sleeping, sexually transmitted disease concerns, mental health, which we know is big no matter what the age, particularly through 2020. Pregnancy concerns, and headaches. So it gives you a little idea then to what we were referring from, and when we say referral, that's outside of that clinic setting, outside of seeing the provider there. The provider is through Caris Health. That's not any service of ours, that's through Caris. So it's the nursing services that Prairie Lakes contracts for us to do. So there were 18 referrals for either mental health or psychiatric needs, 7 for dental needs, and 4 for optometry. So you can just see the graph there on the nurse sick calls versus number of residents that they actually have. So you can see in 2020 that the number of residents was also lower, so it would make sense that the nurse visits were also lower. Any questions about that? Some of the other big pieces that we do both in Prairie Lakes and at the group homes is medication audits. That's a statutory requirement that we need to do. Once a month audit their medications. And we also do the training for the staff that pass the medications at both the group homes and at Prairie Lakes. So those are a couple of the other things that we provide as a contracted service for them. Questions?
All right, Commissioner
Mr.
Burke.
Chair, yeah. The funding for the program, the reimbursement then comes through a contract with Prairie Lakes Youth Program?
Yes, it's hourly. We charge them our hourly contracted fee for a nurse and for support. So Alicia would also help if anything's needed in terms of support. And yes, that is then billed to Prairie Lakes.
Just for other
Yep.
people's information.
Question from Administrator Klein.
We don't do Greater Minnesota Family-Based Services, do we? Group home?
No.
Okay. We don't anymore? Okay. I was just,
Any other questions on that one?
All right. We probably have about 7 minutes left for you.
Oh,
Wanna-
good grief.
Just so you know, I just want to
Doing
give Jenny a
good.
little time at the end here, okay?
Yep, we'll go through the last story, and that's
Thanks
the
so much.
Child and Teen Checkups Program. Again, that Ashley's primary for that. Linda is the support person that works with that as well. She's not up here right now, but that is a program where it's completely about outreach for us. We are trying to make sure that these are all kids that are eligible or enrolled in medical assistance. And so we're trying to make sure that they meet all the parameters of when they should go in to see their provider. All those specific parameters, 2, 4, 6 months, all the way up through 21 years. So our work is all around outreach. We're out there in the community as much as we can be. Again, 2020 brought some challenges for that. We did the best that we could. We focused a lot on some of the adolescents at Prairie Lakes because we could see those folks. And so we focused a lot of our outreach in that parameter, but otherwise we're out in the communities and we're also calling. So that's part of what Linda does. We get enrollments from the state of people that are newly enrolled in the program. We call them, we tell them about it, we send them letters. We send letters during certain parameters in time, giving them more information. It's time for your checkup. Please, call your doctor. So you can see we mailed over 6,000 reminders and we called over 2,000 folks. So it's a lot of just on the ground work just trying to reach out. One of the things that Ashley and Linda have done in the last year is some fabulous radio ads. I don't know if you guys have heard them. They've done on multiple of our local radio stations, and they're really, really good. So if you have an opportunity to catch them, please do. I think you can certainly read the rest of it. I don't know, I probably didn't do justice, Ashley, to your program, but I know Ashley and Linda worked really hard on this. And we're at the fair. We were at the fair again this year. I know you guys were right next door to us, a couple of you, so spent a lot of time out there trying to educate folks on just healthy childhood, appropriate things to do and keeping your kids healthy. Yes, and we got a purple ribbon. Yes.
We were
Remember
jealous.
Yeah. So we didn't have a lot of those types of outreach activities in 2020, but we hope 2021 will bring some more of those. I know we're going to the firehouse next week or the week after, early October, to do some more outreach. So the other things quickly that you'll find in there, and I'm not going to go through them, are the storyboards. Some of this is going to be repetitious to what I said today, but usually I do these once a year, and it's more about the CHB. So this is all a combination of Candy and Renville. Some of the programs are immunizations. So if you're interested in more specific breakdown of each vaccine, I do have whether we have gone up or down recently on this one, so you can look at that at your own time, as well as active and latent TB, a little more explanation, environment health, and an emergency preparedness one that talks about the health alert network, which you can read that and learn more about what that means. But I just wanted you at least to see those. Those are generally something that we do share with the CHB board as well, just to give an idea of what's going on across the whole CHB. So a couple other things that I was going to touch on that are new in 2021. Well, we have an influenza grant, not exactly new. We got it in 2020 and didn't use all the money because the pandemic came across the state. Many of the people that were awarded this grant didn't, so we're able to use it into 2021 now. But we got grant dollars, and mostly the purpose of that was to kind of see what it might look like to do field or mobile vaccinations, right? We already had a really good experience with that because we go out and do worksite flu clinics every year. But some of you may have participated in the very first, we did a flu clinic as a drive-through over at the rescue squad. That was our very first practice at a drive-through, and we learned a lot from that, and we learned that this is a good thing and this can work really well, and I think you all saw how well that worked through the pandemic. So we still have some of those dollars that we're going to use this year during our worksite flu clinics. We recently were awarded a worksite development grant. This, again, comes through the CHB, so it's Candy and Renville. It's coming federally, came from CDC through the state to us, and it's really about supporting a COVID prevention, preparedness, response, recovery. So we are able to use some of that money to train some of our staff on how things went in the pandemic and how we might change some of our things moving forward. And we were also able to hire somebody. So we're going to start, we don't have her on board yet, but she will be 3 days a week to help us with some of our community partnerships, strengthening those, assessing the needs and the impacts of COVID and recovery, trying to identify some of the needs maybe in some of the harder to serve groups and areas within our county. To help assess some of the health disparities. So we're looking forward to that. That will start in October, goes through June 30th of 2023. And we just got something called the Healthy Housing Grant. This will be Carmen's responsibilities. All these new things we're getting her into. What that is about is we'll be training her on how to go in and assess houses for safety. We're targeting more young families in poverty, but it is open to anyone. We aren't setting a parameter. But it will be looking at a home assessment and providing either some mitigation, actual mitigation that the grant will allow us to purchase some things, or more education around safety things, whether the water needs to be tested, whether it might be lead, whether the carbon monoxide detectors, do you have a fire extinguisher, those kinds of things around safety and mitigation. And again, that one will start in October and go through that June 30th of 2023.
And likely there'd be some collaboration then with our HRA as well and with some of those issues.
Absolutely, with some, support and resources, absolutely. We'll be connecting people with resources. And again, this is a CHB grant, so this will be Renville and Candy, Ohio County doing that work.
Okay. Questions from the board, Mr. Kleindl?
Linda and Ashley, do they use Zoom for the child teen checkups?
Well, I have once for when I did some training for the clinic. Otherwise, we're out in the community as much as we can be.
I have no question.
All right.
Just a general comment, not being a commissioner, but for years I always heard about Candy County having an outstanding public health program and being funded by this by the county as well. And I just want to really point out, it's my understanding that every county is different. Every county's public health program is different, and we have a very strong one. And over the years it's been, and it looks like it's really paid off, especially the last couple of years. So thank you.
This is the reason why, these guys over here.
All right.
And good leadership too.
Anything else from the board? I just want to finish up by saying it was our privilege to go around earlier this summer and thank everybody who did stalwart work and continues to do that type of work each and every day throughout our county system. But you all can rest assured that you saved lives. I don't think there can be any question about that, and I don't think it should be minimized. You saved lives during this pandemic. And for that, we owe you a deep debt of gratitude. And so thank you for everything that you do. Okay. All right. Thank you for that. And Director Lippert, anything for us on updates?
We do have a couple minutes, so I will just quickly talk about COVID since it is still here and I have the most recent statistics with me today. So currently right now, Candy, Ohio County has 141 active cases. I'm trying to put it into a week's time frame so we can kind of gauge how many new cases per week. And actually from the last time I spoke with you, it looks like we're down a little bit, so that's good to see. From last week to this week, we saw 101 new cases. I think when I was here, it was like 121 new cases, so a little bit down. But we did have one new death in our county. So again, strong encouragement to those who are listening. If you haven't received your COVID vaccine, please do so. They're still saying that, yes, there might be some breakthrough cases, but those breakthrough cases are seeing minimal side effects, less hospitalizations, less long-term effects. So please go out and get your vaccines. One other new thing is the state is now launching a new mobile app where individuals can go on and get their immunizations. So I would encourage anybody to go to the Minnesota Department of Health website and take a look. I believe the app is called Docket, and then you're able to see when you would have gotten your COVID-19 vaccine, as we're hearing more and more that you need to have your card and what happens if you lose your card. That's a really good resource for our community. We're still having weekly clinics here through Public Health on Wednesdays from 1 to 2 p.m. And then also Caris Health is holding routine vaccinations and also some local pharmacies. Testing has been a subject, again, we would assume with more cases, there's more testing going on. So again, if people are looking for testing sites, you can go on the Minnesota Department of Health website to find a testing location near you. Locally, Caris Health is doing a lot of testing. They're still doing curbside testing, and then some pharmacies. We still have our weekly health and medical call. Again, that's the collaboration call with the different partners in our healthcare system and emergency responders. And we are just kind of gauging where things are at with our local hospital and healthcare system, and we'll be making changes to any of our public health plans if we need to.
Mr. Chair,
Mr. Bird.
what is the county's role going to be in booster shots that we have been reading about or hearing about coming up? Anything clear on that yet?
Yeah, there has been no guidance on that. So until we get further clarification, we're having some internal conversations. What if it goes this way? What would our role be? What if it goes that way? We're also having conversations with Caris Health. But at this time, there has been no direction from the FDA and nothing that has been relayed.
A brief question, Jenny. Are we seeing more serious hospitalizations with this at present, or is it fairly holding steady?
I would say that I think the last thing I saw from Caris Health is the hospitalizations are mainly those folks that have been unvaccinated. And yes, there are some ICU level of care needed, but a small fraction then of vaccinated individuals that are needing to be hospitalized.
Understood. All right. And by the way, I forgot to mention, thank you this morning for my flu shot. I appreciate it. Anything else from the board? If not, then I will adjourn the meeting of the Human Services Committee.